Hi, everyone. I'm Dr. Sheila Segerson, Director of Shelter Solutions at Maddie's Fund. Welcome to Maddie's Monthly Behavior Connection, a monthly webcast that's all about animal behavior. Our guest today is Tabitha Kucera. Tabitha is an elite, fear-free, and low-stress handling certified registered veterinary technician, a veterinary technician specialist in behavior, and I want to call that out because there are only 33 of you in the world. So super special. She's also a certified cat behavior consultant and a Karen Pryor Academy certified training partner. She's the founder of Chirrups and Chatter Cat and Dog Behavior Consulting and Training and is the animal behavior technician at the Gentle Vet in Ohio. Today, Tabitha will be talking to us about feline communication and how to respond appropriately to what cats are telling us. Welcome, Tabitha. It's good to have you here.
Stoked to be here. All right. So let me get started. I'm so excited.
All right, that looks
Think
great.
Awesome. Thank you. Thank you to Maddie's Fund for having me. If any of you have followed my work or in general, you understand how important behavior is, and it literally applies to everything. So I love that they have these monthly events. They have a lot of other great resources too that I'm sure you're familiar with. But I always like, because behavior, I always like to explain the why when I'm talking about something. And I'm sure you all know why body language is important, but sometimes I feel we know a little bit more than we do. And I say that about myself as well. I went to vet tech school. So I went to school, took boards similar to a human nurse, and I learned very little about body language. So I can say pretty surely that the majority of us didn't really learn much. We know the red, like that cat, ears are back, they're tense, they're similar to this cat, they're experiencing fear and stress. But this cat probably gave 20 to 30 signals before they got to this point. And I wasn't taught to recognize any of those. And again, I went to school. Some of us learn on the job and don't have mentors who are maybe more skilled or experienced than us. So body language is really important. And I'm always working to improve, as well as you awesome people who are here doing CE in the middle of the day. But of course, we want to provide the best care we can and prevent and decrease stress, because we know stress increases disease processes, whether it's upper respiratory infection, but also can cause GI upset, decreased appetite, over grooming, learned helplessness, and in many cases, defensive aggression or aggressive behaviors. Elevated fear, anxiety, and stress can also increase the risk for some labels that aren't appropriate, like feral, if they aren't feral, which I know that can be a bit challenging, but it's all body language and context, right? Aggressive or unadoptable. And of course, the more we understand a cat, the more they're likely to be safe, feel safe. So then they're going to eat, play, groom, and rest, engage in social behaviors that increase adaptability, and they have generally less stress during care and medical handling. Also, this is a really big one: empowerment through awareness. Sometimes you may be working with a colleague or volunteer or even a friend, and they may say, "This cat is fine," which is not a helpful term, right? Or you understand that this cat is experiencing severe stress, things are escalating due to the approach, or they may be experiencing pain based on what is being done to them, right? Complex. And obviously, communication between staff is really important, but I also understand them saying, like, they're not fine. That's not super helpful communication or productive communication. So when I'm describing the body language I'm seeing, it's a lot more empowering. Like, hey, I understand that it feels like this cat's fine, but actually see how when I change my approach, the face softened up, the airs went forward. So you're literally describing what you're seeing, and that's proof of what's happening. You can also adapt your approach to that animal. I'm a more advanced handler when it comes to handling cats and dogs, and I literally adapt my approach in that second to what that cat is giving me. Handling is a skill, and again, that's not something I was really taught as a technician as a skill. What I was taught, I tend not to utilize anymore, because know better, do better. We're always growing. But you can also help to advocate for cats in your care. You may be a behavior nerd or have a little more experience with body language and recognize that this cat is really fearful and is not doing well in this cage environment. So I can move them to a higher cage where the door isn't, right? Versus a lower cage where they're walking in and out, people are walking in and out. There's little tiny things that we could do to manage, prevent, or decrease stress in every environment, from a foster home to a shelter to a vet clinic. And understanding body language is a huge part of that. Also, it improves communication and consistency, right? It helps people reduce labels and promotes consistent documentation and support across shifts, right? You may be working with this cat once every, maybe every other day. You may be a volunteer that comes in once a week. So it's really, obviously, we're always assessing body language. It changes, we're assessing throughout, but having an idea of that animal's baseline. So like, what is their normal, which also looks different for every cat, super duper helpful for everyone that is working with this cat. You can also identify the things they like. This cat likes to be pet with this, like a hand with mild pressure. Yeah, I get detailed. And then you can let their potential adopter know that, and you're setting that cat up for success with that adopter to build a bond, but also you're setting that cat up for success and that adopter to interact with that cat in a way that's respectful and kind, right? Because sometimes, people misread body language and they're hugging cats and doing lots of things to cats where the cat is definitely saying, please stop, please stop. And I'm sure that people aren't malicious in where they're coming from. They just don't understand, right? So it really helps to also prepare the cat and the human for success. So I'm going to talk about the body language scale today. There are a few body language scales that I have utilized with shelters that I've worked with and vet clinics, but the one I'm going to talk about today is the fear, anxiety, and stress scale through Fear Free. And I really like a scale because it helps to provide a clear criteria. Like I said, you can communicate this with fosters, adopters. Of course, I'm not saying print this out and give it to your staff and say, we're doing this now. I see that happen sometimes. You're not setting your staff up for success, right? I'm boarded in behavior. So my FAS 3, as someone that's really skilled in that thing, right, may be different than someone else's FAS 3 who doesn't have as much experience, right? So we have to make sure everyone's on the same page and feels confident and empowered. So it's not just here, right? It's more like, let's do something like this. Let's practice, which I'm going to talk about later. There's so many benefits to using a fear, anxiety, and stress scale. This is another one that they have. A big thing I love about it is it's an objective measure. So it's how an animal is feeling based on observable signals. So again, versus narratives and some things that I sometimes hear, it's actually based on what the cat is telling us, which is really great. It helps to ditch labels and encourages more empathy for the animal. I'll get more into that. And again, it empowers you to respond appropriately in real time. As a skilled handler, literally, I adapt my approach second by second. If I'm interacting with a cat in a cage, I adapt my approach based on what that cat is showing me. I adapt my approach to what enrichment they enjoy, how I play with them, everything, right? We all know cats are individuals, but I often don't see us necessarily adapting to what they prefer or like. And sometimes it could be even challenging to identify what they like, which is where body language is really helpful. It's a common language, and then it's also helpful diagnostically. I won't get too into that. But for example, if this cat's baseline is FAS 2, and you're a caregiver that's with that cat every day, and you notice that that cat is FAS 3 to 4, or even 3, and you take in the context, what's going on, and then you notice that they're FAS 3, a few days, I'll be honest, my brain's going to go to medical. And I want to share that with the vet because that cat's baseline. That vet team, sometimes we don't even have a vet on staff. They can only do so much with the minimal time they have. That cat's baseline. And that information is super helpful to identify pain and other medical issues. Or if they're being treated for a medical issue, we can identify how they're feeling. Is this treatment helping managing their pain, managing their disease process by their body language? So I don't want to get too into this, but I'm extra sensitive because I'm a behavior nerd. I think it's really important the words that we use when we're talking. You may be talking to your friend after hours, having a drink, living your best life. That's totally okay. I'm focusing more on when you're in the shelter or vet clinic, or even when you're talking to colleagues. Sometimes I'm very aware of my language because I see, again, I'm super fun, but I see the severe damage and suffering that humans and animals receive due to the words people use. Like, that's how deep it is. So if you're speaking in your shelter to fosters, colleagues, I think it's really important to ideally use objective language, which is not influenced by personal feelings. It's based on facts. And then versus subjective, which is influenced by personal feelings. And these are just a few examples, right? It is raining and I love the rain, pretty harmless, versus my cat is mad at me, so she went outside the box, which is something I hear a lot as a behavior consultant, versus what the cat is actually feeling. My cat is having accidents and may need medical and or behavioral help. In most cases, both. And again, even if a caregiver loves their cat, because they most likely do, when we're saying my cat is mad at me, and to be fair, they feel that way. So they feel the cat's spiteful. That's another common one I hear. And that human that cares about that cat, we're going to kind of create this narrative already. Like, they should know what they did. They're not going to contact me. They're not going to contact their vet. They might just open their door, versus my cat is having accidents and may need medical or behavioral help. They immediately empathize. And I'm also not lying. That's the truth, right? I always relate it to, you would never get upset with your kid for vomiting on you at 3 p.m. You might be tired and have to deep breath because it's stressful. And I recognize that. But caregivers immediately understand what I mean. Or the cat bit me out of nowhere, right? That's very rare. As someone that deals with severe behavior cases, I'm not saying it can not happen, but I'm going to be honest with you, it's very rare. Usually there's a lot of signals and context prior to that. So this is just an example. As they approached, cat was hiding in box with ears back, body crouched, tense. Person approached abruptly, full frontal. Like, I never approach a cage like this. But they just were like, opened the cage, loomed over the cat and scruffed it. I understand why that cat bit you. I don't want you to get bit, but I don't want a cat to be in a situation where they feel there's no choice to bite. But I also don't want you to be in a situation where you may get bit. So I care about both. I love everybody. So this is a word I'm extra sensitive to. So fractious by definition means unable to handle. And again, I'm a very skilled handler. So let's say everything is data. Let's say you're at a vet clinic or at a shelter and you're using this word to describe a lot of cats. That's still helpful information for me. That tells me that we need to help empower the staff and do some practical handling workshops with someone like me or someone else that's very advanced in behavior and handling. We have to help this staff have multiple things that they could do with this animal to prevent and reduce stress and teach the staff body language, versus just being like, all cats are fractious, right? Or if you're seeing that a lot, that's information, versus what this cat is fearful. And again, I'm seeing these less and less, which is really great. But there used to be fractious signs that would go on a cage. And I love communicating how that cat is feeling. Of course, that's helpful. But you have to realize when you see fractious, you can know nothing about considerate approach or fear free, which I'm not going to get into today, only so much time. But you're more likely to be tense. You're going to approach like, oh gosh, I don't want to deal with this cat. Versus if the cage card said fearful, you can know nothing about considerate approach, advanced handling, fear free, and you're going to use considerate approach accidentally. You're going to move slower. You're going to be more empathetic. You're probably going to have a plan. If you're not comfortable with handling fearful cats, you may ask for help, which is amazing. So just a word makes a really, really, really big difference. So these are just there's a lot. These are just some of the common things I hear, right? My cat is bullying my other cat. There's no bully or victim. As someone that deals with this a lot, both cats are struggling. We have to identify which. And there are many cases where people are saying, this cat's bullying the other cat. And actually, it was the other cat that had severe fear and stress. Again, no bullies or victims. Those are harmful narratives that don't help to identify what's actually going on, right? They're spiteful. That's a huge one. If you take anything from this, please never call a cat spiteful. It could be such a huge difference. It could save animals' lives. When someone's venting, let them feel their feelings. I empathize with them. I understand that. Like, I understand how frustrating this house soiling, because it's not inappropriate elimination. There's nothing inappropriate about it. Again, language, it's house soiling, right? I understand how frustrating this can be. It's really hard, but I'm going to help. And I know it can feel like they're spiteful, but that's a human thing. Cats, dogs don't feel that. So again, I'm like empathizing with them, but unpacking the actual information. This cat can't live with another cat. I consult with a lot of shelters and I see that on paperwork. And I'll be honest, 90% of the time when I say, what behaviors did you observe that made you note this, they cannot provide much. So that's another thing. Even if a caregiver or a colleague who, again, they're venting, they may have feelings, right? If someone says a cat is an A word, which is another word I hear a lot amongst my colleagues, which is a bummer, the simplest way to approach that empathetically and non-judgmental is, what behaviors are you observing to make you feel that way? Like, thank you so much for sharing that. What behaviors? Immediately, you're going to actually get helpful information. That person's going to be more empathetic with one sentence, right? And then many times the shelter's like, we put them in a room with other cats. I'm like, well, yeah, no cat is okay. What? Right? So then I help them identify and create SOPs. But again, big narrative, like this cat can't live in a home with other cats, based on, when I ask, really not any actual information, which is where behavior is also helpful, because sometimes we feel stuck in situations and we're not given criteria. And we're like, this is how it is. And this is where behavior and body language can be really helpful. No spicy cats, fearful cats. Ooh, spicy. Let's not do that. So again, labels don't describe behavior or their cause. It kind of puts the cause of behavior inside the animal, right? They're spiteful. They bit out of nowhere, right? Which then we can't help. We can't identify what the causes of those behaviors are. It creates narratives like, this cat hates all other cats. Based on what? Right? It can't be tested. Hey, Tabitha, this cat really likes that. And I'm going to be like, based on the behaviors, this cat doesn't. But they just keep saying this cat really likes that. That doesn't happen, but that's just an example where this cat doesn't like that. And this cat gets a lot more stressed out with the way you handle this cat versus more advanced handling techniques, right? And again, the cause of behavior is found in context, not animals. We have to consider all of that. So here's just some fun labels that I tend to see a lot, which I'm sure all of you do. If you have a label that you don't see, that you hear a lot, throw it in the chat. I'll check it out later. I love hearing it. So when it comes to assessing body language, because again, we're not going to use huge harmful labels, right? And that's where the body language score can be helpful, because I also understand that you can't write ears back, body crouched, right? So once you're confident and always practicing with that FAS scale, you could write FAS 2 on arrival, FAS 1 after being here for an hour. A lot of the shelters I work with at minimum do an FAS score on arrival, day 1, 2, 3. But again, there's a lot of ways we can utilize that. So we're going to observe everything, right? Facial expression, ears, eyes, tail. We're going to interpret, because it's an emotional state, right? These animals cannot control. These are physiological responses. Just like when I'm happy, I smile. It just happens. I don't think about it. And you're going to continuously evaluate, right? So this is just a chart I made because there's so few charts out there. I had to make one. And you can see at the very top of that ladder, it says bite, scratch, bite, utilize aggressive behavior, right? Versus what we see in the green, it's kind of what we call displacement behaviors, which are normal behaviors, but taken out of context. So the person that drinks a lot of alcohol and or water, you take a lot of drinks when you're just a little slightly like, I'm in a new room, right? Or you kind of like, you're a little shy during because I'm a trail runner, and like you avert, I notice I say hello to everyone, but I know sometimes people like subtly avert their gaze. It's not about me. It's just subtle conflict, right? And the more stress the animal gets, and human, we see more and more of those displacement behaviors. So you could see 4 times a minute, right? Tail thumping, orange, and it escalates, right? So if we can recognize the green, yellow, orange, we can prevent the cat from going to the red. So that's why that's really helpful. So again, body language is how animals communicate with us. They're emotional signals that are instinctive displays of body language, and they're triggered by the animal's internal state or emotions. We want to look at the whole picture. So for example, this cat is very fearful, doing some offensive aggression. Like, I'm going to make because sweet babies don't want to fight. They're like, I'm going to make myself really, really big by heightening up my piloerection along my tail and my back, and have my front legs higher than my back legs to make myself taller, because this cat is saying, please give me space. I do not want to fight you, right? And this cat is obviously exhibiting some discomfort, but context matters, right? This dog was super cash, not very sweet dog, right? But understandably, this cat was like, whoa, and became instantly alarmed, right? Once that dog was lured to another area, that cat quickly returned to baseline. So similar to when someone like drops, because I startle easily. So like if someone drops one of those large metal bowls that we have in shelters in like an echoey room, I tense up. I might even yell a word. And then I quickly return to my baseline, right? This cat is giving so many signals for this lovely person from Canva to please stop. And this person means well, as you could see. But this cat has probably, I mean, just in this photo is giving 15 signals to please stop. But this is where I may hear a caregiver say, this cat bit out of nowhere, when, whoa, did they not? But that's where body language is huge. It's so important. And we also want to consider context. So we want to consider what's happening in the environment, right? Oh, that dog was walking and kind of the cat was behind. So literally the dog kind of came out of nowhere, and then the dog disengaged. And once the dog was even 2 feet away and not looking at the cat softened a little bit. And then within 30 to 60 seconds, with the dog away, the trigger, that cat returned to baseline. But we also want to consider physiological elements: pain, disease, illness, sensory deficits, fatigue, anxiety, right? I say this all the time. Hopefully none of you have chronic pain, but if you have chronic pain or pain in general, or you have anxiety, whether it's generalized or situational, everything is harder and everything is more intense, right? It's why the person in a horror movie hiding in the corner, someone coughs and they urinate on themselves. All stimuli is more intense, which is where we provide hiding spaces, right? I utilize topical lidocaine. Well, I do that anyways, but I don't always utilize it for vaccines, but I'm going to in a high FAS cat, because I know even with a small needle, everything is more intense in this fearful cat or painful cat. And we want to consider their physical traits as well. This cat may have had an injury prior to being in your shelter and they don't have their tail anymore. I can't look at that as an indicator of how they're feeling. We also want to consider the conditions, or again, what was happening. I remember this amazing girl went to one of my body language lectures, this amazing girl that was working at a shelter. She was very young, so smart. She practically started applying everything instantly. Whoa. And she reached out and said that there was a cat in a dog crate. So not the best situation. It was fairly small. And the dog crate was on the floor, which cats prefer to be up. So again, just context. And this cat bit someone, and she recognized immediately why this cat bit someone. And people were throwing around really dangerous labels, like harmful labels. When we looked at context, she's like, this cat was on the floor, was not covered, didn't have appropriate cage set up to begin with, like hiding places, vertical spaces, all of that. But also they started vacuuming, everybody. The cage was right here. They were vacuuming and then reached in and scrubbed. Yes, of course that cat bit you. What? Right? So they were using really harmful, and she immediately was like, oh my gosh, I totally understand why that cat did that. I didn't want. So that's where we really have to consider context and what we're doing. And then also prior learning. There's a lot of reasons why cats are afraid of carriers. Their previous learning history with those aren't positive. We can make that better, totally. But we have to be aware that if they have a negative learning history with something, that's going to affect how they deal with things in the future. I'm not going to go too into pain because I think, but I have to touch on it. So body language is pain. I can identify like a painful cat in like a Zoom or at a shelter in like 2 minutes, 1 minute, because it's all body language, right? So this is some of the more common for me to really simplify it, but we see that hunched appearance. As you can see with this cat, I mean, this cat is full on triangle, like this cat is in severe pain, but you also see that movement, how, you know, this cat was very slow to turn around. So, hey, I sit like this, but if you have some chronic hip pain, you might sit like this, right? And also their tail carriage is low. So again, we're looking at that fluidity of movement. Or this cat, for example, I'm going to forward this, but she takes this long to, she wants to jump down, but she really has to think about it because she hurts. And then when she does jump down, you're going to see she braces the counter a bit. See how she braces? There's not like a quick jump. Her tail carriage is low. She has a subtle back arch, and she has really long strides with those rear legs. There's more going on, but we can see this in a lot of cats and shelters. And I'll be honest, I consult with a lot of shelters, and I love that they reach out due to aggressive instances, or maybe they're having some challenges adopting a cat out. And the amount of time that these cats, there's other things, but pain is a huge contributing factor, and it wasn't even on anyone's radar, is blows my mind. So this is something that you don't need to be a veterinary professional to help identify. And again, we all need each other's help. Their facial expressions also tell us a lot. There's something called the Feline Grimace Scale, which there's an app and you can find it online, even more resources. Unfortunately, with dogs, we see similar things, but we don't have a validated pain scale because there's so many breeds, so it's challenging. But with cats, these are the things we look at. So this is a cat that's startled, for sure, but is fairly non-painful based on these things. This cat, I mean, that orbital tightening, these last two cats just look like they have migraines. Those whiskers are starting to straighten out. And the only time whiskers really straighten out is due to pain. And again, that head, so we have a head high, head neutral, head low, the second cat. The third cat's head is just like, I mean, you could probably say, Tabitha, I feel like that cat doesn't feel good without knowing anything. But when you can describe why that cat doesn't feel good, we can actually get that cat help. So again, one of my clients, so this cat is severe pain. Again, orbital tightening, the ears are kind of, there's so much tension, the ears are kind of to the side, that muzzle's closed, those whiskers are straight, that head is low. Same cat years later, because all my caregivers know what pains look like. So even once we're done consulting, this is her cat with moderate, not severe pain. And she recognized it immediately and brought her cat to the vet. So it's a game changer, right? We can help these animals sooner. And this cat has chronic medical issues that has a great vet team, but there are still flare-ups, right? You can't cure pain. So although we've worked with her vet to identify and diagnose and treat these things prior to, this cat may still have flare-ups, but this caregiver is ahead of the game and saving money because they're getting them in there sooner. So this is where I had to talk about pain a little, but these are some practical strategies for categorizing cats, right? So we could use body language scoring. We want to avoid assumptions and observe each cat individually. So I'm going to just break down the FAS score with some examples. So FAS 0, as you can see, this when I think of a loose cat, when I'm like lecturing in person, which we're technically here, I'll say loose, wiggly, limbs and tail are as far away from these two cats as possible. And then the more conflicted a cat gets, everything goes in. And then, oh, trigger's still coming. I've given 30 signals to please stop. I have to fight. That's essentially what we see. So these cats, loosey-goosey parties. Eyes are almond shaped. We're going to get that soft blink. Ears tend to be forward. Tail tends to be, again, just hanging or U-shaped. So this cat, softest little face ever. Look at them cheeks. Oh my goodness. But I'm going to show you a cat later who is actually under severe stress, and they're doing something called feigned sleep. So I want you to take a note of how soft this cat's brow and face is. Because I think tension like when we're looking at cats, I think tension is a little harder to see. Like I can feel it in a shoulder. as I'm handling, right? But I'll be honest, even, 8-10 years ago, I wasn't noting that shoulder tension. I was noting it once it was throughout half the body, right? So practice, practice, practice. And then with fear, anxiety, and stress score 1, so we have some subtle, again, we're still green, like early yellow right now, right? So they may, like this cat, head is slightly averted. So, right, this versus, right? So head is slightly averted. They're lip licking, which is a common displacement behavior. We're getting some mild tension in the brow, and those eyes are going from almond shaped to round, right? This kitten was startled, as you can see. Those eyes are fairly almond shaped. The ears are starting to go to the side a little bit. You can see that he kind of is focused on the stimuli. So it's a person and he's shifting his weight. So he was just, again, this was a startle, like, what, dude, where'd you come from? And then he returned to baseline and frolicked away. Which, well, actually, I don't know his baseline, but because I haven't hung out with him a bunch, but he returned to FAS 0. So that was just a quick, like, whoo. So this might be a cat that pauses while eating as you approach, but then resumes quickly eating again, right? Maybe shifts away, and then you take one step back, and then shifts back to forward and head goes up. So this is an example of a cat that is FAS 1. This is a vaccine clinic. So you can see his eyes are going from almond shape to round. There's mild tension. It's not like severe. There's mild tension in his brow. He's kind of hypervigilant. So he's kind of like averting his gaze from me. I'm doing rough rubs because he likes those. And he was a little too fearful to eat some of the treats that I gave him. He preferred rubs, which are my go-to for most cats, to be fair. But he arrived FAS 3 or 4. But I took his carrier apart and, I used treats to lure him out. And we started his exam in the back end. We did a lot of Fear Free related things. And he did great. He was FAS 1. And then by the end of the exam, he was FAS 0 playing with me on the bottom of the floor of the vaccine or of the vaccine clinic. So again, kind of adapting in the moment. FAS 2 or 3, right? So with 3, we tend to see a lot more displacement behaviors. So we're going from like green to yellow, and then yellow to orange is 3, right? So we'll see that crouched posture, leaning away. You're going to see that increase in respiratory rate. So you're going to see that abdomen go up and down quicker. They'll most likely have their head down a lot more. We call it furrowed brow or more tension. So not mild or subtle. It's going to be more noted tension in their face. We'll probably have some more pupil dilation, but not completely dilated. And they tend to be looking at the stimulus, whatever, which also helps you identify what's making them uncomfortable, right? Super, all great, helpful information. So this is an example. So you could see the respiratory rates pretty quickly already. Everything's folded in. Those whiskers are starting to clump together and go back. Eyes are round, pupils are dilated. One ear's to the side, focusing on the threat. Okay, I'm averting my gaze. I'm escalating. I'm trying to get away from you. I have piloerection along my back now. My respiratory rate increased more, right? So then she closed it and took 3 steps back. And then he approached the front of the cage again. Again, that FAS 3 went to an FAS 2. FAS 4. So FAS 4 includes flight and freeze, right? So flight, this is what how most cats exhibit fear, anxiety, and stress. So flight, actively trying to escape, pupils dilated, right? Like this cat by this cat tree, they're like, just get me away, man. I'm not here. I'm not here. Like, please just give me space. I don't want any trouble. Like, they're just like, right, flight, hide, which is why hiding is a natural coping mechanism. I mean, cats need to hide even when they're not scared. So that's hiding locations in cages and group rooms are as much of a need as water and food and litter boxes, right? So ears are back, focused on threat. You're going to see both of these animals, their whiskers are completely like, they naturally sit here and sometimes are subtly splayed out. And then as they get more aroused, maybe focused on a toy or aroused, they splay out more. But these two cats, they're going down, right? And a lot of people would miss this kitten's body language, right? They may pick this kitten up and say, I'm going to hug them and cuddle them. This cat is frozen in fear. Like this kitten is terrified. They're as small as they possibly can get. Their head is low. Those whiskers are just like, right? Those eyes are going from almond shape to round. It's hard to see, but there is furrowed brow there, and the ears are starting to go to the side. So these, or the cat that just freezes, kind of like a meatloaf cat, right? They're just frozen in fear, and they do really well with like gentle handling, allowing them to hide. That's where we're going to use towel handling techniques if we do have to handle them for some reason. But if I'm cleaning your cage, I don't need to interact with you, nor should I, right? You don't want to interact with me. It's not personal. I should respect you. The more positive and consistent human interactions you have, the better you're going to do, right? So if I have a cat even exhibiting 2, 3, 4, I'm just going to, especially 4, I'm going to cover your hiding box that you're already in with a towel. Or there's amazing shelters that have the portal holes that can actually close while they clean on this side. I don't need to interact with you. I need to make this as less stressful as possible. So this is an example. So you can see she's already kind of like shifting her weight into that corner. And then as the person approaches, she shifts it more. All her limbs and tail are held close. Her eyes are essentially round, pupils completely dilated. Sorry, it's blurry. Real life videos. And the person approached closer, so that cat hissed, escalated, like, hey, I'm uncomfortable, please give me space. So the person just put 2 treats down and then walked away. And that's what the cat was looking at when you saw the cat's head go down. There's another kitten. And then goes closer again, gives another treat. So that cat's already softening up a bit. Like the tension in the face and brow has softened up a small amount. And she's more exploratory. So versus like, so I would definitely not tell this colleague of mine to reach in and pet this cat. This cat is not soliciting petting, does not want to be petted. But because she approached, recognized her body language, she approached from the side and not like this, right? She gave a few treats at the front of the cage, not reaching towards the cat, even with an item, took steps back. And I saw that like 3 or 4 signals soften because of that person's approach. And again, each time we are assessing and adapting to the cat, they do a lot better. This is a cat that I mentioned. These are those cats that are feigning sleep. So I understand how people pass them by and it appears as if they're sleeping. So this cat is, versus that floofy big cheek guy, right? This cat is the person in a horror movie that's like, I'm not here. That's very different, right? And I triage behavior like I triage medicine because I understand we can't do everything forever, right? That's just realistically, we have to trigger or we have to prioritize. This to me is a cat that's bleeding out. So to me, you know, if we're seeing a cat like feign sleep chronically, there's lots of little things we can do. I mean, again, adapt their environment. This cat did not have a box, for example. Lots of little things that we could do to make a really, really big difference. Or this cat is terrified. I'm sure you can see his eyes are as wide as they possibly could get. His pupils are dilated. His whiskers are kind of smashed against his face. His ears are back. There's a lot of tension in his muzzle. And this is their thing to promote this product. I'm not a huge cat backpack fan. And the reason why is, even if you're a low stress cat, you can't move. I'm all about allowing animals and humans to like move and be comfortable. And also no one's assessing the cat's body language. So it's just like trigger, expose you to all the things. And I'm like, whoa, that would make every animal not do as well, right? And then we have FAS 5, right? So this is where we're seeing offensive or defensive aggression. In most cases, honestly, you're seeing defensive aggression. Let's say you are seeing a lot of offensive aggression. Data, right? That's data that we need to work with the staff and help everyone be more empowered. Let's look at our environment and identify little things that we could do to decrease stress. Like you heard classical music, all of those videos that I've had had hiding boxes. There were multiple, the food and water was as far away as possible. Lots of little things that make a really big difference. So this is just the written, but I have some pictures which are easier. And this is just a fun fact, just a fun trick. So if you're working with a cat, and you are approaching the cage, again, medically, whatever, however you are, and they're exhibiting defensive behavior where eyes are round and dilated, and all of a sudden, as you're approaching, you notice their pupils get constricted. Stop what you're doing. Even me as an advanced handler, I care about that cat and I care about me. So I'm going to cover that cat up with an additional towel if that was not already there. And then I'm going to utilize pre-visit pharmaceutical. There's lots of creative things that I can do in that moment, because that cat, that, you know how I use that example where please stop, please stop, please stop. That's what happened. This cat has been pushed to the very end and they are going to lunge. They are going to choose offensive aggression. So fun fact, just a lovely thing to note. So again, this is more commonly, everything is back. Those whiskers are back, tension throughout. Those ears are back. We might see some subtle piloerection, but you're also most likely going to get hissing. The trigger kept approaching this cat, so that's why that paw came out, right? Because they're going to, and then they might start rolling and like pawing. Versus this kitten, everything is forward. It's hard to see, but right, those ears are forward. Those pupils are constricted. The cat is actually climbing the wall to prepare to jump. And this was a feral kitten who was scared by someone walking a dog past an alleyway. Dog kept walking. And then we went back and caught the cat with a drop trap, right? Because I'm never, ever going to scruff and pick up a kitten. I understand they're smaller, but this kitten will bite you. But also, I want to make the drop trap the bad guy. I'm going to work on some in-depth behavior modification and socialization with you. Why would I start off with a horrible negative association with me? And again, these are not the type of patients you are most likely dealing with, but my job, I get to deal with high FAS patients because I'm more skilled at these things. And then I come in and then I leave. So this is a cat who's offensive aggression. So it's hard to see them, but they are tense, spitting. I mean, this is pretty loud. So we did something called transmucosal administration. That's, again, lots of handling stuff. But this cat was in horrible pain. Horrible, horrible pain. Was dealing with some essentially almost blocked, lots of, which is why the cat was acting like that. They're not bad, like all these labels, right? This cat felt, I work at vet clinics, I do vet stuff. This cat felt horrible. That's why they felt like that. That's why they were doing that. So again, still helpful information. So some general tips that are really good. We should always observe before interacting. And I'm not saying like you have to stand there for 5 minutes, but I'll be honest, I think even as a baby tech, I would just go up to it. Like it blows my mind. I would just like reach in, which I would never reach in now. But I would just go like full frontal reach in, not assess body language, not adapt as a baby tech, because I wasn't taught any of that, which is why we continue to learn. So we should always observe before interacting and assess from a distance. Like, and when I say distance, if we have a cat with a lot of fear, I'm going to go here versus here, even if I'm feet away, and assess. And then if I go here, I'm assessing. And then when I go here, I'm assessing. And it's, you get better and better at it. And it's really helpful because when I go here, it might not be me. It might not be the person that's a trigger. It might, if I notice no change here or here, it might be something else, right? So I can get more information. We're going to monitor during the interaction. And of course, we're going to adjust our approach based on it. And I think the hands-on retention part, I get to do tons of practice. So do you. You get to work with animals every day. But I think we really should take it to another level, right? So it seems silly, But sometimes in my handling more in-depth day consults with shelters and vet clinics, like how I do this, and then I'll be like, hey, what's a fearful cat? And I would have them do the ears, because when you're doing it with your body, you understand it, right? We all know, like, I love reading a book, right? But that I have to practically apply it in different ways. Teach your team. I teach for a living, which is how I've had the benefit of learning all this really, really well, because I get to teach it all the time and learn from other people, right? So teach, hey, we're going to have at our staff meeting, we're going to have 15 minutes where we play 3 videos and we're going to talk about the FAS scores throughout and what context was happening, right? So you can role play scenarios where you're like, I'm a fearful cat or dog. And then how do you interact? So it's fun. It's low stress. It's an environment that's conducive to learning. I'm not like, hey, FAS 5 cat or dog, go. That's not a helpful teacher, right? So you can practice those skills with each other. And then you can also focus on one part, right? So somewhat like, okay, I'm going to watch without interfering. I'm going to pick one part and kind of get a feel, right? So just based on these photos, I'm always going to be open and get context, but based on these photos, I have eyes almond shaped to round, pupils dilated, moderate tension in that first brow. Just based on that, I'm getting that moderate tension throughout this whole area. The second cat, subtle tension in that brow. Eyes are almond shaped going to round, so less fearful than the first cat. And then again, there's that subtle tension. And those ears are, I think this ear may be about to go like this, but there's subtle tension, or those ears are fairly neutral. Context. This cat's very scared, terrified, right? As far away as possible, closed in, whiskers are down, ears are back. This cat is FAS 1, right? Because those whiskers naturally sit here. You see how they're just starting to go down a bit, right? And then she had one lip lick, but you didn't get, I was actually here, so I have more context. She had a lip lick, and then her eyes started to get wider. So I noticed that little whisker thing, the lip lick, and her eyes get a little wider. I was getting engagement photos of my animals, because of course I was. And photographers are great, but they know nothing about body language. Want another job? I'll give you all the money. Because if I need fearful animals, I just have to look up kids and animals, and it's a bummer. But she took a step forward with this really big camera, and I noticed that change in my cat. So I was like, oh, hey, can you take a step back? And then I let her know what my cat, and then my cat whiskers went back up, that face softened. So again, it was just, she wasn't going to bite her, but our goal should not just be, right, pushing the cat to not bite us. That was a super tiny little things that she said, dude, that camera. So she could still take the photo with one tiny step back. And I was planting seeds for all the other animals she works with, which is great. Or this. So with this, those claws aren't out, right? They're pretty soft. And the cat is in front of the cage. So that's what I'm getting. I can see the whiskers, but it's hard to have context without the face. This cat's muzzle is very tense, and those whiskers are starting to really splay out. So context, look at this soft little baby. So again, because we also look at body, like backward tends to be fear, neutral tends to be content or relaxed, and forward, it can be offensive aggression, but in most cases, it's like more relaxed or curious, which isn't a bad thing. So as you can see, this cat's soft as heck. I mean, his body, you feel softer looking at this kitten. And he's trying to play. This adorable kitten is actually focused on a toy they're going to kill, right? So that's where that tension is coming from. And that's where you could really see those whiskers start to splay out. So this cat isn't fearful. They're like, I got to kill that bird toy, right? Which is where context is really helpful. And then last but not least, because play and aggression can be really challenging. So I used to not have, because there's only so much time, right? But I think it's really important to cover this, because the amount of caregivers and colleagues that I see who interpret play behavior as not only aggression, but also other stuff. And it results in rough stuff because people don't get more information. They don't ask open-ended questions. Cats are prescribed medications, and it wasn't indicated, just lots of complex stuff. And to be fair, play and aggression can look really similar. So it's challenging. Like with play, there tends to be more similar to dogs, more circular movements. There's breaks. It might be, so it might be a second break, or it might be a disengagement. We tend to see chase back and forth and minimal vocalizations versus aggression, right? So you could see that this cat on the other side escalates. So that tail's going, they're lip licking excessively, tension throughout the body, ears are forward. This other cat is also fearful, but you're going to see that this cat started at like FAS 3, went to 4 pretty quickly, and then goes to 5 within, because that's how behavior works. But also this cat is so that's FAS 5. And unfortunately, this caregiver was told to feed the cats on both sides of the door. You have to do that at non-stressful starting points, which is different for most cats, because this was flooding. Hey, you're scared? This is how you eat. That's rough. But then, this cat is now doing like rolling. Those are conflict reducing behaviors. Like, hey, because they're clients of mine. The cats are best friends now. So that other cat's like, hey, I'm watching you, but the eyes are almond shaped. And I think she's looking for a toy because we do door play, right? And then this.
Okay. You ready?
Oh, those are my clients talking. I get videos of everything. So did you see that like bouncy jump? Right? Bouncy jump, movements are a bit slower. Blah, he bites, the other cat bites. Cat disengages, cat goes to get other cat. I think he legit just flops. Yeah, he's like legit flopping. So these cats are playing, but I totally get why the caregivers thought that they were exhibiting aggressive behaviors. So I know that was a lot of information, you amazing people out there, but some of the takeaways that I would love for you to have is understanding body language and body language scoring. These are essential tools for feline welfare, animal welfare, right? Use observation, not assumptions. Ideally, avoid labels and instead describe behavior. We want to be consistent with staff. So set up staff members for success. You may be the behavior nerds, but we have to help everybody. And to be fair, when I go to shelters, everybody wants to learn. They want to do their best by all their animals that they're working with. And we should listen to their whispers, which tends to be green, yellow, right? So they don't have to scream, which is red. Action steps. I love an action step. You are already practicing all the time, which is great. Share what you learned with a colleague. Never stop learning. You're ahead of the game. Some of those exercises I mentioned earlier. Maddie's Fund has some other resources on body language. I have a lot of free resources on body language at my website, but also on my social media at Chirps and Chatter on Instagram and Facebook, and Behavior Vet Tech on TikTok. Have lots of videos. This is a really great book that I recommend to all my colleagues and caregivers, that I highly recommend. And thank you to Maddie's Fund for having me. And again, having this awesome monthly behavior thing. And for all of you amazing people, for everything you do, but also for going above and beyond and being like, I want to learn more. I want to do better. That's all we can do. And you're out here doing it. So thank you.
All right. Thank you so much, Tabitha. This was an amazing presentation, and just love your enthusiasm about this topic and all things pets, and especially cats. Let's jump into Q&A. Our first one is, what are your thoughts about checklists for observed behaviors in conjunction with using an FAS scale? Do you like using checklists, or you prefer using the numbered scale?
So first off, that's a great question. And this is where there's no one size fits all approach, which I think is fun, but I know it makes it more challenging. So I work with shelters that do FAS scales and checklists. And I love that if the whole staff is familiar with how to utilize those. Like the one shelter that I work with, a shelter in Rhode Island, that's amazing. And they do FAS scores, but they also do a more in-depth checklist on arrival 2 days in, and when they start implementing BMOD, behavior modification, after each session. so they can really get more information. Or again, I have some shelters that do FAS scores and then the checklist first day, third day, especially because that transition can be really challenging. Or when they go into a foster home, like with big changes with the checklist. But if you can use both and your whole staff is comfortable with that, yes, more information is always better.
Great, thank you. So next question is, early on in the presentation, you discussed communication and knowing if a cat gets along with other cats. In that, you mentioned a staff member might say something like, they do not get along with other cats because we put them in a room with a lot of other cats and they do not like that. They do not like it. Regardless of the words they use, what are your thoughts on colony rooms in shelters?
Whoa, love it. So I think that group rooms, if we're talking feral colonies, that's a separate thing because ideally feral cats should be outside for reasons that all of you understand because we care about their emotional and physical well-being. But I'm sure you mean as in group cat rooms. I think that they can be great. Again, it depends on what those individual cats are telling you, which is where body language is so huge. Because I'll be honest, I do see cats sometimes where I'm like, it is very obvious that this cat is very uncomfortable in this space and they have to live here every day. And when you have a stressor every single day, stress gets worse. It gets harder to deal with. You get stressed more quickly, right? So that's where, when it comes to cat group rooms, I think they're awesome, but I think we should have like standard operating protocols, which includes a lot of body language assessment and gradual introduction, which can look a lot of different ways. And then also assessing how those cats feel in that space. And of course, there's a limited amount based on how the space is. The shelter veterinarians have a lot of great guidelines. Maddie's Fund has some guidelines as a starting point. Guidelines aren't black and white, but they're helpful for starting points too, because obviously, right, I had 3 siblings growing up and lived in a small house, and that increased my attention, and I was well socialized, right? So when we have 12 cats in a small room who most likely didn't go through kitten kindergarten and did not have those experiences, those positive, we're asking a lot, right? And that's probably not best for the cat. So I think they're awesome. I think we just have to adapt and assess which cats do better in these spaces than don't. And that might change. Like if they're getting along with all the cats and you're seeing like mutual grooming, them laying on the same piece of furniture, like also identify what criteria means that they are enjoying the other cats. Because again, you might be a shelter worker and you're like, I'm not sure. And that must be frustrating for you to not have that criteria. So there's literally criteria to see if cats are enjoying each other's company. Like again, resting on the same piece of furniture, obviously sleeping together, but I very rarely truly see that bonded type. I see it, but not as often. So having even clear criteria, I love an SOP. Let's make SOP sexy, everybody. I know they sound boring, but they're really great guidelines. So it was a long answer, but.
Love it. Thanks. All right. Another housing related question. In my shelter, when we have a cat experiencing high FAS, we tend to cover their kennel with a towel. We also provide a hiding space inside the kennel. If we are already providing hiding spaces inside their kennel, do we really need to cover the front of their kennel door with a towel? I may be overthinking things, but I feel bad that they don't have any light going in and are constantly in darkness. Just to add, we generally add 1 or 2 hiding spots or more if the space allows for it.
Amazing. First off, love your awareness that you may be creating narratives because we're all humans and we do that, but you're already aware of it because you're amazing. And love that you offer hiding spaces. So in most cases, like if I have a cat, again, it depends. Everyone's like Tabitha behavior. But in many of the cats, like let's say you have an FAS 3 to 4 cat, right? Especially a frozen and fear cat, but FAS 3 to 4, I would provide them hiding spaces and cover their cage. And now could you cover their, like, let's say this is the size of their cage. Could you cover it? If the front door is here, I would probably prefer you don't cover this much. So then choices are cool. I love agency. I wish we provided animals with more choices. So could you cover the majority, again, cover the part with the handle, but cover the majority up and leave a little open? Totally. But in most cases, it is indicated because, again, how I talked about that fight or flight response that humans and animals feel, that when you are in fight or flight, everything is more intense, including visual, auditory, tactile, all of it, all of that stimuli. So that's where, especially with FAS 3 to 4 to 5, right? Cats having the hiding space plus doing what you can to minimize any stimuli, like classical music. There are door panels that you could buy that are soundproof for really cheap online, that soundproof rooms, like lots of things that you can do. But I also understand, like, because you may not be sure how that cat's feeling. So, hey, leave them a little bit of choice, but I would still cover 75% of it. But that's a really good question.
Thank you so much. And I just have to add, because it's a important topic to me, that if their stress is not reducing over time, we really need to consider alternate housing like foster care or office foster.
Right. So we, again, assess and adapt. Great point, right? Like we're going to assess and adapt. And do we have a quieter room? Like there's a lot of, I could think of 15 to 20 things in each individual shelter, because all of your shelters look different, but we should be taking that as data versus being like, this is how it is. And that's all body language. Like, so someone might not be as understanding or progressive and say, why do we have to do this towel? And instead of attacking them or shaming or judging them, we can help them understand and then see how her body language, she's FAS 3 now, and she was 4 for the last 2 days. And these are the things we change. So you're also helping them understand and not being like, this is how we do this, because that's also not the best approach for humans.
Great. Thank you. And I just realized I lost track of time and we're a little bit over on time. But thank you, Tabitha, so much. And thank you to all of you for watching today's webcast. Appreciate y'all being here.
Thanks for having me.